Hello and welcome to the Headache Doctor podcast, where on this podcast, it's our mission to educate and empower everyone with headaches and migraines so that you can break free from a life of fear of your next headache or migraine and dependence on medication. In today's podcast, we're going to talk about the difference between a migraine and tension type headaches. I'm your host, Dr. Taves. I'm the founder and one of the providers here at Novera Headache Center in Colorado Springs, and Parker. And if you are looking for headache and migraine relief, you are in the right place. In this podcast, we're going to talk about very practical, helpful things that will educate you and then empower you to make decisions towards a better health. In this podcast, we're going to talk about the two most common types of headache presentations, head pain presentations. So that's migraines, and then that's tension type headaches. Now, when it comes to interacting with someone initially and talking through their story, their journey, getting an idea of how their symptoms present is helpful and valuable. Now, one of the things we hear often is that people will say they have two types of headaches. Sometimes it's a migraine, and it's a debilitating, oftentimes one-sided pounding, throbbing sensation. And then other times it's the tension type headache. Typically the tension type headache is a lower grade pain. They can work through it, but it's there, and it's probably more prevalent. It lasts for a longer period of time. It can be onset later in the day, or as the day goes on, it'll build. And it's more of a band or strap-like presentation as opposed to this one-sided pounding, throbbing pain that is the classic migraine presentation, okay? Now, a few things I want to hit on here. When it comes to discerning if you have a tension-type headache or a migraine, we need to back up and understand that these diagnoses may be helpful in some scenarios, but other scenarios, it may not really matter so much. And so we're going to talk about the difference between why someone would have a one-sided debilitating, pounding, throbbing sensation, and then why someone would have a strap-like, band-like presentation in the front of their head, and then why there's treatment approaches that can solve both problems, okay? Now, when it comes to understanding the diagnosis that you're receiving or trying to understand, like, is this a true migraine? Is it a tension-type headache? We have to back up and see that our healthcare system uses these categories or these diagnoses of different types of head pain in order to put people in a category, and largely those categories are leading you down one avenue of medication or another, okay? And so on this podcast, we want to solve the underlying problem. Oftentimes that's going to trace back to the neck, jaw, shoulders, and because we're on this journey to understand what the underlying issue is, the diagnosis we care less about, and we care more about the symptom presentation. So where is the pain presenting? How does it present? What time of day? What are you doing? What are the activities? What are the triggers? And what tissues or specific parts of the neck, jaw, shoulders are irritated, sending that pain signal? Because those things we can actually treat and understand how to address the underlying problem, okay? So in our world, as physical therapists at Novera Headache Center, treating headaches all the time, we see both types. We see tension type headaches and migraine presentations. They're the most common types that we see here in the practice. One thing we see is that oftentimes people will start with potentially a less frequent but more intense classic migraine presentation. So it'll be the one-sided pounding, throbbing that is debilitating, accompanied by light sound sensitivity, sometimes nausea. The aura can be there. So the classic migraine presentation, in a lot of people's journey, that'll be how it originally presents. And as time goes on, really what's happening is the problem isn't solved, and the neck continues to increase in tension. There's dysfunction, there's irritation, and so it goes from maybe an increase in that typical migraine presentation, but then you also have this low-grade tension type headache that's there. Not everyone. Sometimes people have more of a tension type headache that builds and turns into a more debilitating presentation of pain that can be more just all over, but really intense, okay? And we have patients all the time that say they describe their symptoms as a migraine, but they're like, I'm not totally sure because it's not like this one-sided pounding, throbbing. It's more like a band or pressure that just feels like it's squeezing my brain or is in the front of the head. And that can also be debilitating. So whether you have a migraine or not, the intensity of your symptoms, whether it presents like a tension type headache, that band or strap in the forehead, or a one-sided like ice pick behind the eye, wrap up and around the head, they're both have potential for being debilitating, okay? And so there's kind of a spectrum here, but generally the tension type headache will be a lower grade type of pain that's more diffuse, meaning it's not like specific to one side, but just like the front of the head hurts, feels like a strap or a band in the front of the head. And then the migraine presentation will be more specific and oftentimes more intense, okay? Like more debilitating. You have to go into the dark room and basically take a nap until it goes away, hoping it goes away. That's where we're also reliant on pain meds, the abortive pain medication. Oftentimes people are taking triptans, things like that. Whereas tension type headaches, usually it's potentially low grade enough where it's like really annoying, kind of aggravating, but you get away with NSAIDs or over-the-counter drugs. Okay, so those are generally the categories that we're seeing. And sometimes people have one or the other, and sometimes they have both. Okay, now what's happening here, and how do we discern for you in your situation if this is a migraine, is it a tension type headache? Like I said, that may not be as important, but what I'll do is define and describe what's happening in the neck that would lead to a more specific type migraine presentation, and then what's happening generally that causes more of the tension type diffuse, more forehead type pain that we see with the tension type headache. So first off, in the migraine presentation, we often are going to see a specific segment of the neck that is irritated. Okay, so think of the upper part of the neck, anywhere from the base of the skull to C3. We'll see a specific segment, maybe it's C1, C2, C2, 3, the head sitting on the first bone, which is referred to as the OA joint, or C0, C1. So any of those segments, if there's irritation, is fair game to send that pain signal into the brain. The brain realizes, okay, there's a problem, and it attributes it to the head. Now, oftentimes, the brain will interpret that signal and get the side correct. So meaning if it's the left side of the neck, that side of your head will hurt. Especially if you have pain in the upper part of your neck, just before you hit the base of your skull, that kind of fleshy part is typically the area that most people will have a sensitivity. Now, if that's where the migraine kind of starts, if you have pain there, and then as it increases in intensity, it shoots up and around, you're basically experiencing in real time a substantial neck issue or irritated joint that is ramping up in intensity, and then your brain is receiving that signal, and as the intensity grows and increases, it basically is referring that pain into the front of your head. So it's a lot of it is the perception, right? The sensory input is there, and then the brain's perceiving and interpreting what's happened. So it's not as if there's anything that is directly impacting the tissue as it runs from the back of your head up and around to your eyeball. So for example, if it feels like it's stabbing in your eyeball when it's really bad, we can send you to an optometrist, ophthalmologist, look at your eye, look at your vision. This happens all the time, and they won't be able to find anything. Generally, that's what happens, okay? So it's not as if this presentation is like, oh, there's a stabbing behind my eye, and it's like, there must be something in my eye. And most people intuitively know that. They know that there's not something wrong with their eye, and especially if it starts in the neck and wraps up and around. Okay, so the point there is that presentation generally, as far as treatment and how the neck is presenting, it's a joint specifically that's, and usually it's a few joints, but the neck on that left side is just really aggravated, and the joints themselves are just tired, and they're inflamed, and they're sending that pain signal, okay? Generally, that side of the neck will be more irritated than the other, okay? So if you have a dominant right side presentation or a dominant left sided presentation, that part of your neck in the upper three joints will be the primary area that will find like that sensitivity. So let's say oftentimes it's going to be the OA joint, so the head sitting on the first bone, or the C1, C2 segment. Now, either of those segments, if we press on them, try to get them moving, they say, oh, I haven't moved in so long, and it's kind of like we're poking the bear, right? Like it's irritated, it's inflamed. What'll happen is it'll actually reproduce that pain signal. So people will feel, oh, the pain is kind of traveling up into my head. Now, as providers, we love that because not because we're inflicting pain on someone, but because it tells us, okay, that's the site that we need to focus on. And if we can calm that down, your migraines will improve. Okay. So it's actually pretty exciting when we can replicate someone's presentation of pain inside a session. And usually that can happen pretty quick. And so when we replicate the pain, we calm that joint down. Oftentimes the patient will leave even that session feeling better. So it's not as if we poke the bear and then it just gets really angry and stays angry. Once we work through it and improve the mobility, the joint irritation calms down and that pain signal calms down. Okay. So the traditional migraine presentation, I would say, is something we treat very frequently, and very rarely does it not improve, or very rarely do we not get someone to their end goal. And those people that present with a little bit more challenging presentation, that's where our whole three-spoke framework comes in, when we look at developmental barriers and we look at systemic barriers. And so essentially everyone that's dealing with these issues, we're able to understand and solve the underlying problem or problems. And but for some, it's a very sort of simple to understand, maybe not as simple to treat, but simple to understand mechanical issue in the neck that's just sending pain. Okay. Now we're going to look at the tension type headache. So the tension type headache generally is not just one or two specific joints, but it's going to be multiple sites that are sending pain signal to the brain. Okay. And generally the muscles themselves are more involved. So this is where we see a lot of shoulder tension and neck tension, and the scalenes and the SCM, which run along the side of the neck, are really inflamed and irritated. And then we have like the upper trap and the levator scapula, which run from the shoulder blade up into the neck. Those are also pretty irritated. And so there's just this resting level of tension that's running through the neck and the shoulders, which when we have this front temple and forehead presentation of pain that's not specific to one side, it starts to make sense when we think, okay, there's just all these different structures that are irritated, and that irritation is being acknowledged by the brain. And instead of like having pain on one specific side, it's just like the front of my head generally hurts, or I have a strap-like presentation in the front of my head. Okay. Now, in that scenario, we are often looking at things like improving stability generally of the neck, or function of the shoulders and the neck, so that we teach the neck how to operate in a way that's efficient, right? Like use big muscles for what they're intended, use smaller muscles for what they're intended. We don't have this, we want to get out of this mismatch where like just being upright is stressful for your head and neck throughout the day, and you feel like, man, my neck gets tired and I need to lay down. Like we want to get you out of that because you're just carrying general tension, and being upright and whatever your day requires of your neck, it's going to increase the amount of tension you're carrying. And that's why oftentimes afternoon, evening, you see that tension headache creep up. Now, there's a lot of overlap here, a ton of overlap, because it's not as if someone will have exclusively a joint problem. I mean, it's like rare that someone would have just, okay, here's a few joints, and once we clean those up or get those moving, you're good. And then on the other side of the spectrum, it would be extremely rare for someone to have just muscle tension generally, but not have the underlying joint restrictions as well. So these things go hand in hand. And oftentimes what's happening is when we get an idea of how someone's symptoms are presenting, we know that the primary irritants, or the primary tissues that are sending those pain signals, are like the loud, noisy ones are either muscles primarily, and maybe there's some instability and general tension, or it's more of a specific joint presentation. Okay, but kind of across the board, we're going to find, so let's say in the migraine situation where someone has like a specific joint issue They also are going to have tension through their shoulders, dysfunction, irritation in different spots of their neck, and just general mobility issues, okay? And that's going to be true in the tension type headache category as well. So general tension, but then typically the tension type headache category patients will also have restrictions through the joints in the upper part of the neck. And so we have to consider how the pain is presenting, and whether it's tension type or whether it's more of a specific pain that travels on one side, it starts in the neck, wraps up and around. And then we have to move forward with our plan of care, knowing we have to address what we find clinically, right? And so we get the neck moving, we reduce tension, we improve function, mobility, get this person so they're able to tolerate what their body needs to handle throughout the day without increasing tension, without seeing that irritation increase and leading to the headache or migraine, okay? So yeah, when I started the podcast, initially I was saying, okay, the diagnosis doesn't necessarily matter as much, and that's true, because if you come in and say, well, I have a migraine and then I have a tension type headache, and some people will get caught up in, okay, you're a physical therapist that works on the neck, okay, you can work on the tension type headache because that's, intuitively like, okay, you work on muscles and so the tension is coming from my muscles, so that makes sense. But the migraine is something different. No. And to be honest, we actually probably prefer the migraine presentation. Those patients oftentimes will have a quicker response to treatment as opposed to the tension type headaches. That's not always true, but within a couple month period, both are going to generally find the relief that they're looking for. Most patients will, but the specific joint pain, irritation, wrap up and around, pounding, throbbing, debilitating type presentation of pain, we would probably say that's slightly more responsive to treatment than the tension type headache. And so when it comes to the traditional diagnoses and how our healthcare system looks at them, they would look at those diagnoses and say, okay, migraine is a neurological issue. This is a spontaneous neurological event, and so you need medication. I just had a patient recently who talked to their neurologist and said, like, do you think I could be referred to a physical therapist? Do you think the neck could be involved at all? And the neurologist said, well, there is something called a cervicogenic headache, but you don't present that way, so no, your neck is involved at all. And then it was basically, you just need to keep taking medication because that's the only thing that I've seen help in this scenario, and wait until you get to an age where you might grow out of it in your 60s or something like that. Like, it is so kind of depressing and hopeless and frustrating. And so just know that that's not the case. If your neurologist has told you that, I am living testimony day in and day out for the past 8 years of my life, have been correcting the medically diagnosed, multiple neurologists diagnosing migraine. Okay, it's through and through migraine. It's the bread and butter of what we do. If you have migraine as a diagnosis, I want to encourage you to stop thinking of this as a neurological issue that needs medication and a very treatable underlying neck, jaw, shoulder issue that we can solve and has just been missed. And most of you out there are probably intuitively thinking, oh yeah, like I've always known my neck has an issue, but I've tried chiropractic, tried physical therapy, and it just hasn't really hit the mark. That's okay. A lot of people we work with are in that same boat. So what I would encourage you to do is not get caught up in these diagnoses. If you have any type of head pain that's been ongoing and you have not been able to figure it out, I want you to reach out to us. As at the beginning of this podcast, you may have heard the ad talking about our 3 avenues. So if you're like real sheepish and just want to try the SAM device, go ahead and order that on Amazon. If you're out of state and just looking to get started, we have a virtual coaching option that is fantastic and helps a ton of people that have not found relief otherwise. And then, of course, we are in Colorado, and you can either travel to us, or if you're in Colorado, come see us at one of our 2 locations. Thank you all so much for listening to the Headache Doctor podcast. What I would encourage you to do is, if you felt helped by this, leave us a 5-star review so that we can continue to do this and get this in front of people that need to hear it. Share it with a friend. Copy the link, send it in an email and a text to whoever may need to hear this. Thank you all so much for partnering with us as we continue on this journey to educate and empower everyone with headaches and migraines so you can break free from a life of fear of your next headache or migraine and dependence on medication. I'll see you next week.